Hi, my name is Vicki Ellingrod. I am a clinical pharmacist and an associate faculty member in the College of Pharmacy at the University of Michigan, and also a member of the steering committee at the Michigan Depression Center. My research within mental health is really focusing on the medications that people use. And the goal of my research really is to find ways, or to look for genetic variation to determine who is best suited for a specific medication or who is at highest risk to get a side effect from a medication. And so my goal is that within the next 5 to 10 years, people would come into the Depression Center, we would know their entire genetic history, and then we could say, based on this profile, you have the greatest chance of responding to this medication, and so we're going to give you this medication. Or we would say, you know, based on this history, you're at really high risk for side effects, and we really want to avoid those, and so we're going to put you on this medication. And in that way, people don't have to put up with a lot of the bad side effects that we see from medication. There's a huge safety issue in there because one of the major causes of someone being admitted to the hospital is due to a medication side effect. And so if we can prevent that and optimize who's going to respond to the medications, then we can have lower overall healthcare costs as well as better outcomes for people that need to take medications. So in terms of my research program, they tend to focus on kind of personalized medicine or pharmacogenetics, which is the intersection of medications and genetics. And so what I'm looking at right now is there's a certain class of medications that when people take those, they're called antipsychotics. They're sometimes used in bipolar disorder. They get used in people with schizophrenia. They're sometimes used in other mental illnesses as well. But when people get put on those, the risk for developing diabetes, high lipids, and cardiovascular disease in general is extremely high. And so we're looking at determining the genetic risk factors that may be related to that. And we're also looking at the role of diet, and we're finding the whole mind-body connection is extremely important in preventing cardiovascular disease in all of the mental illnesses. And so that's kind of what the focus of my research is right now. I think the Depression Center and being a member of it is a tremendous honor. We're the first national depression center. We're the leaders in terms of the network of depression centers. Being a pharmacy member is great because I get a network with people that are prescribing these medications and that are using them on a daily basis. And I actually get to guide, you know, the future of pharmacy as well as the future of psychiatric medications. And so I think being on that cutting edge and being part of this group from the ground is a really great honor.